Hi there, and welcome to Canceling COVID. I'm Tanya Rivens as we get zoomed in here. There we go. How are you on this fabulous Tuesday? So glad to be with you. Trying to make sure I got my lighting right. I still have some more work to do, trying something different. But I appreciate you tuning in on this wonderful Tuesday as we continue to address the issue of COVID and all that comes along with it. Um, what can I say, folks? We're still making this effort to keep you educated, to keep you informed. I see a couple of you starting to hop on. Of course, we're so grateful for that. My name is Tanya Rivens. We pride ourselves on bringing you real resources, real talk, real solutions, and just keeping you informed about what's happening in our community. Again, the title is Canceling COVID because together we plan on making a difference. Now, today I've got some exciting information to share with you. Of course, we've got Dr. Trasha Black of Groundwater Solutions who's going to join us. And then later on in the half hour, I've got none other than the amazing Tracy Alston, who looks at mental fitness and mental wellness, and just an innovative way to address the issue of what's going on with mental health. So we're going to talk about that. One of the things that I wanted to point out in the headlines, of course, is looks like over in the UK they're starting to say just handle COVID like it's the flu. I want to talk to Dr. Trasha Black about that. Of course, we know that we'll be living with this, and it's kind of the new norm, something that we'll have to address and deal with. But we wanted to also check in on testing, get an update, see how things are going, if they're trending down. From what I understand, even with our hospitals, I saw where in some areas it is starting to, maybe we've peaked already and things are starting to die down. We'll talk about that and a whole lot more. So let's go ahead and jump in because we always have so much to talk about. Again, this is Canceling COVID. I'm Tanya Rivens, and let me bring on Dr. Trasha Black, and she's with Groundwater Solutions. So good morning, sis. How are you doing?
I'm doing great. Good morning, beautiful.
Oh, thank you so much for taking the time to talk with us. I'm having trouble with my lighting here. So yours looks absolutely amazing.
Does
Um,
it?
yeah, so I'll try to lighten things up here a little bit more as we continue. But let's talk about where you are with what's going on. Say,
Mhm,
let's start with testing. What are you seeing? Numbers still heavy? I know around the holidays they really did spike, but
mhm.
are they continuing?
They are continuing to spike.
Mhm.
They're pretty steady. We're still running at about 40 to 50% of tests are coming back positive for COVID-19. That's been pretty consistent following Christmas. And we expect it to remain at that level for maybe another 2 to 3 weeks before we see it begin to trend back down.
So another few weeks, so maybe
Maybe
the
mid-February.
February.
Yeah,
Yeah.
by Valentine's Day, we like markers, and so by Valentine's Day, we hope that those numbers are down. But it's really up to us. What are we doing in our own communities, in our families, in our homes to stop the spread? If we're
So
not doing it,
what should we be doing right now still? What should we be doing?
so we should be limiting our gatherings. Quite honestly, just until the spread of the virus decreases, we should not be having elective social gatherings. Yeah. And if we do, then we should be doing testing prior to those gatherings. We should be wearing masks. We should be social distancing. We should govern ourselves like there's a dangerous virus out there because it still is.
So we know come Valentine's Day, that ain't gonna happen. I mean, we just know Valentine's Day, everybody's got plans, trying to make a reservation, trying to get out,
Mhm.
so hopefully this thing will start to die down by
Mhm.
mid-February. I was telling people hopefully by the end of January, I was pushing it a little bit. So, and I think that's one time what it was based on results from South Africa.
Mhm.
Isn't that correct? How it just kind of came and spiked and it
It
died back
came
down?
and it spiked, yeah. And I think because of the way that COVID spreads, we're expecting, especially people who have COVID now, we know that it's likely that there are probably three additional folks who are infected for every one person that we test. So
Uh,
until those numbers, it's got to continue in the trajectory that it's going, and then it will die down. And like we said, Omicron, we're seeing it's less severe than
mhm.
the original variants of COVID-19. So we're seeing folks who are ill, they're having flu-like symptoms, but we are seeing less hospitalizations, but we're seeing just such a massive rate of infection. It's just so easily spread, but it is much like the flu. I think you said in the headlines that we're going to have to treat COVID-19 like the flu. Well, it is. It's now becoming a virus that we're learning to manage it much more effectively than we did at the beginning. But again, the spread is likely going to continue.
So do
Especially,
you agree with that statement then? This was in Britain. The president, Boris Johnson, he said that they need to start living with COVID like it's the flu. So you kind of agree with that statement?
I've believed from the very beginning that it was going to be multiple years before we had it in a manageable state, but I do not believe that it's going to go away. I hope within the next year in 2022 that it's going to be manageable, where we're not seeing those mass numbers of folks dying because of COVID-19, that the spread is controlled, but I do not think it's going anywhere.
Wow. So, if it's not going anywhere and we're going to handle it just like the flu, but does that necessarily mean that we are actually going to stop, get to put the masks down? I mean, I couldn't understand why anyone would want to stop using the hand sanitizer and kind of keeping their distance as my lighting just tumbled over in front of everything. But the new normal, as I see you still working, sis, we're
I
always working, trying to juggle so many things.
I
Do
know.
you see us keeping the mask on though still?
I think in certain situations, it's going to be recommended that we mask at large events, stadiums, concerts, things like that. I don't see anytime soon, at least for the next couple of years, that we're going to be in environments like that where it's going to be safe to be unmasked. Unless we know that. And I think it's about testing too. If we're in a situation where you're having rapid tests before every event, and the numbers of rapid tests, they're hard to come by now. So are we going to have that level of safety where we know before we walk in the door that everybody in the room is negative? I think until then, masking is going to be one of our primary forms of safety. And we've got to have the right mask. We've talked about masks before, and every mask is not created equal. So those who walk around with cloth masks or just pulling something over their faces, we know that doesn't work. So I think the more effective we can be, the more likely we're going to be able to have those kind of large congregate gatherings again. But I don't see masking going away.
Well, shout out to Atrium Health. I'm an ambassador that works with them, and they're distributing over 1 million masks, and they donated. I guess I had Ooh, almost 1,500 donated to my nonprofit that I've been distributing. Gave some to my Saras, and they've been distributing. There's something I've been putting them in my little free pantry, people that I have contact with. So working to get those out. And believe it or not, people really, really want these masks, and they're right there readily available. And there's an effort, though, from the federal government to give out millions. I believe it's like 400 million. So I guess probably my question, are you surprised that it took them so long to realize testing and mask is where we should be? And I know you're probably not surprised, but this is what you've been saying all
I've been
along.
saying from the beginning that is the key. And no, I think just policymakers, they hope for the best, but we don't necessarily. And I think the world wants everybody to feel good. It's been a rough couple of years. So,
It has.
they've tried to minimize the restrictions so that life could return to normal. But again, we keep talking, there is a new normal that has to be established and
Right.
what it looks like, and we have to be realistic and honest about it. And I think everybody across generations, we have to get on the same page. Do I have time to give you an example of
Absolutely.
so
Absolutely.
I have a senior, and she doesn't seem like a senior because she's the most vibrant, one of the most intelligent women I know. She is a community hero, and she was infected with COVID-19 from one of her grandchildren, who your attitude was, we don't wear masks, and you're coming to your grandmother's house, and now she's infected. Ended up in the hospital for a while, and thank God she's back home, but she is not back to normal. COVID is an illness. If you have those severe symptoms, it is hard to bounce back. especially when you're a senior. And so I just want our young generation. I have folks, one of my sons, who, he thought he was invincible and immune, and he said, "Mom, I'm not going to get COVID." And New
Mhm.
Year's, he was infected with COVID. So I think younger folks are getting it now. And so talk to each other again, have those dialogues and those discussions. Tell your school age friends, please take this virus seriously, because just because you might be okay, there are other adults in your life who may not, should they become infected with COVID-19.
And
Let's
that was one of the things that we've been saying all along. If you're not going to do it for yourself, think about your neighbors, think about your loved ones, think about your parents, grandparents, along those lines. I mean, even today when I go visit my mom, she's 85. I make sure I've got my mask handy.
Mhm,
She's done everything. I'm vaccinated, but the point is, you got to think about what if she ends up getting COVID, and that's
mhm,
very difficult. What's a little surprising to me though is, I know for the state we have a little over 20,000 deaths. I know nationally it's over 800,000, but I'm
mhm,
still hearing of people dying right here in our state from COVID. And it's kind of disappointing because I
mhm,
just thought we had a better handle on that. And I was really surprised of a gentleman that passed away. And yeah, he was elderly, he was in his 80s, but as far as they could tell, he was, fairly healthy,
mhm,
and he got COVID, and they had to make a decision to, remove the ventilator. And I was just really surprised to hear someone still so close, to me, that
mhm,
we're still losing lives.
mhm. Well, I believe that the loss of lives related to COVID-19 early on and the continuing loss is really, it has a lot to do with health equity. And
Mm,
there are disparities in healthcare, and some of it is on us. There are lots
right.
of Black and brown folks who are the ones who are dying. And
Hmm.
it's because it takes us longer. In general, for any illness, it takes us 3 to 5 times longer to seek medical care for an illness than it does other cultures.
Yeah.
So, and just like the hero that I've just talked about, or the shero, um, she needed to go to the hospital probably 2 days before she finally went.
Oh,
And then sometimes we show up at the hospital and we are not admitted. Our
yeah.
symptoms are dismissed. We are given cough syrup and sent home when there should have been x-rays and CAT scans and all of those things that are best practice that don't always occur the first 1 or 2 times that we show up at the hospital. And the experience that I've had over the last couple of years with COVID-19, literally it takes us 2 to 3 times showing up in an emergency room by the time we're admitted, and when we're admitted we're already on the ventilator.
Yeah, and that's just so unfortunate. That's the thing about it, and you're right. But when you're talking about health equity and talking about our community, there are so many layers that
Mhm,
there's no way we could even possibly get it in 30 minutes. But what we do attempt to do is bring you the information and
mhm,
also share some valuable information. So, Dr. Black, I'm seeing, the state is saying a lot of these results are delayed as far as whether you're positive or not,
mhm,
and
mhm,
it's simply because there are unprecedented numbers of
mhm,
testing that's
mhm.
going on. And you've been a big proponent of testing all along. So, where are you guys out and about in the community right now?
So we are always at Indian Trail, out at Highway 74.
Mhm.
On February the 4th, we'll be moving to the Monroe Mall. So we'll
Okay.
still be in Union County, but we'll be at the Monroe Mall Monday through Saturday every day. We are also in Charlotte at our main office at 5104 Reagan Drive. We are at a University Adult Daycare, which is one of our regular weekly sites. We are there today. And drive up, no appointment necessary.
Is there anything else you would like to share before we wrap things up? I've got your information up, groundwater-solutions.org, groundwater-solutions.org, 704-596-0505. I'm trying to figure out why you got this bright light and I look like I'm in a smoky room. And I don't smoke, folks, so
I
I don't
know.
know what the light.
It's like a halo around you.
Oh, I'll take that. I'll take that. I don't know. This lighting thing, we've been doing this so long. We should have it figured out by now, though. I
Mhm,
really
mhm.
should. But is there anything else you would like to share?
Just thank you, Tanya, for keeping this conversation going and helping to impact our community.
Oh, well, thank you. I appreciate that as well. Everyone, Dr. Trasha Black, my sunshine, of course, every Tuesday. Appreciate all the information that she's sharing. Make sure you check them out. phone number and website on the screen where you can contact her. And I appreciate you taking the time to talk with us. Dr. Trasha Davis Black, Groundwater Solutions and Genesis Project. Thank you so much.
Thank
As we
you.
continue, guys, absolutely. As we continue, I want to make sure that you're aware also of an opportunity. This is a report that I'm going to continue to share with you as I get Dr. Trasha Black's information off. Also, she is a sponsor of Canceling COVID, along with Mecklenburg County Public Health, mecnc.gov. That's mecnc.gov, 980-314-9400, 980-314-9400. Also, just want to make you aware of this incredible report. I'm going to have these guys on as guests to talk more about it. The impact of COVID-19 on low-income households and communities in North Carolina. That's a very valuable conversation that needs to be held. We're going to have that conversation coming up, getting them scheduled to come and join us as well. With that said, I want to shift gears a little bit and talk about mental health and mental fitness. We're hearing a lot about it. And one of the greatest individuals that I've been able to connect with is Tracy Alston. She is a trailblazer, groundbreaking in what she has been able to accomplish, especially right here in our area. As a matter of fact, one of the things that I really appreciate about her is that she's got an innovative idea that she is trying to educate our community on. And I had an opportunity to get Tracy Alston on to talk about everything that she's got going on concerning her company, which is Mental Edge Fitness and New Mentality. And that sounds like a lot. She's got a podcast. She's a former athlete at Wake Forest University. This sister is bad. And she has some great information around mental health, mental fitness, always happy, always upbeat, always positive, and something that we really should consider. So let's jump in and talk with Tracy Alston. We have to include in the conversation mental health and mental fitness. And I can think of anyone better than my good friend Tracy Alston, a Mental Edge Fitness and New Mentality. She also has a podcast. She's just incredible. She is that light. And I appreciate all that you're doing in the community. Thank you for taking the time to talk with us this morning.
I can't thank you enough for all that you're doing in the community. And thank you for having me. It's always a pleasure to see you. So glad to be here.
Oh, thank you, sis. I appreciate you. But let's just go ahead and dive in, because more and more people now are starting to kind of pay attention to mental health, but we're not there yet. And based on a report from the State of Mental Health in America, which is based in 2019, it was looking at figures from there. It said prior to the pandemic, almost 20% of our adults were experiencing mental illness. That's almost 50 million Americans. That's a lot of people. And when you look at what we've been going through for the last 2 years, going on 3 years, you know, those numbers could have only gone up. Wouldn't you agree?
Yes, absolutely. They are climbing, and they're climbing fast. And I really believe we're just really at the tip of this thing here. So everything that's going on underneath the surface right now, we haven't seen the magnitude, especially with people being out of work, loss of jobs, loss of finances, financial income. It's putting a lot of stress on the nation. And so when we think about our adults and our parents and our families, the impact not only having at the top, but that trickles down into the household for our youth as well. So we're really seeing a lot of that in my offices as well, where our adults are stressed out to the max, looking for ways to get some support and take care of their mental fitness.
And I applaud them for looking for help. And I've tried to now include therapy as a normal part of my conversation so that people don't feel like there's some type of stigma, which we've had for years. You and I both know it's always, oh, they're crazy. This person's crazy. But the reality of it is, I feel like we all could use a little bit of therapy after what we've dealt with, because it has been just something that we never had to deal with before. And,
Absolutely.
yeah. So, and then our youth, you know, that's a whole nother point. This report talked about the growing percentage of youth in our country that are dealing and living with major depression. About 15% have even had a major depressive episode in the past year. 124% increase from the year before. That number is staggering, and people should really pay attention to this.
Absolutely. I think staggering is the right word, and it's very concerning. And I'm also a radio host and podcaster of the Mental Fitness Matters podcast. And I recently did a show 2 months ago talking about detecting mental health issues in our teenagers, because a lot of times they can fly under the radar. Because normally they're going through this transition, hormones changing, they're already kind of isolating themselves, want to be left alone. So it's sometimes hard to know what it is that you're looking for and looking at. Is it normal teen behavior? Or is there a bigger concern going on here? So I think it's really important that we open up the conversation, teaching our parents on what to look for, how to ask the right questions, but also teaching our youth on how to identify and become more self-aware so that we can get the right supports in place in a timely fashion.
And, I don't even like talking about this, but one of the things that's really gotten a lot of attention over the past weekend is Regina King's son, who committed suicide, which is heartbreaking for any parent, something you really wouldn't even want to imagine having to deal with. And I recently had one in my family. And the first question that always comes up when you talk about identifying is, what are you looking for? How do you deal with that? And the whole issue of the larger increase also being seen in suicides is so concerning, and especially with the COVID-19 pandemic. What are your thoughts along how, because even you just said sometimes you don't even know what the signs are.
Absolutely. And thoughts and prayers to her family. That's just
Amen.
heartbreaking. And so many families going through those same stories right now. And we're right. I think it's a lot of times what we look at with our health, a lot of times we don't start to pay attention until symptoms arise. And if we could start to make this more of a proactive thing that we do, making it more commonplace to speak about mental health and mental fitness, like you just said, making therapy a normal part of our conversation. Yeah. I think if we could start to open up the door of communication within our networks, within our communities, within our families, then we can start to really not necessarily prevent things from happening, but we can keep more of a pulse on what's going on, and people can feel like they have an outlet or a safe place to start to have conversations. So where I would start is really trying to incorporate some type of engagement or conversation in your home, where you might have a weekly check-in, where you're really sitting down as a family unit, whether it's over a nice dinner or playing a game or just having time, that you create a space that's safe enough to say, you know what, no judgment zone here.
Right.
Let's start to create some habits and intentionality around talking about things that may be hard to talk about. And if you don't feel comfortable talking to me, let's be open to seeing who we can get you connected with, so we all have a source of an outlet. So I think we have to start making this more of something that we do on a daily basis, not just trying to put the fire out. And that's where we find ourselves right now, and asking questions.
Asking questions and be genuine with it. I have no problem asking my son, so how you feeling? I mean, really, what's going on in your mind? This happened. What do you think about that? And also, oftentimes people are struggling with fitting in, their sexuality, whatever the case may be. If you're not comfortable talking to me, I've even said, hey, if you can't talk to me, who is that one person that you can talk to about anything? Those are the frank, honest conversations that you should be having with your child, because, there's nothing but pain coming from committing suicide. And one of the things that I actually saw when we were talking about mental health as well, over half the adults that have mental illness, they don't even receive treatment. And a big part of it is because they don't have insurance coverage, which I thought coming out of COVID, that was one of the highlights of a part of this support. And I found that biracial kids or multi-ethnic kids are the ones that are suffering the most.
Yes.
What in the world is going on here?
Another concerning and staggering statistic. Undetected, untreated, and minority groups are really in that larger looking there, where we're needing some of that support but not getting it for whatever those reasons are. And so that I saw that as well. It's mind blowing when I think about the mental health crisis we're facing in America, and people still not getting or having access to clinicians. I'm so thankful now that telehealth is starting to kind of pick up, where people are able to now find a provider if you can't find one locally for whatever reason, but still being able to do services online. That is a plus. And so, it's a lot going on.
Yeah, and I did see where now, because you kind of have to make the adjustments. We've had the Suicide Prevention Lifeline. It's no longer called Hotline. It's a Lifeline now, 1-800-273-TALK. But now, kind of coming up to the new age, there's the 988 where they can text, chat, or call. And I'm saying, what took so long to even come up with these little 3 digits, kind of make it the equivalent of 911. Now we've got 988 and people know that. But Tracy, I know we can't solve this. I just know if anyone's listening, if you're feeling some type of way and feel like you need to reach out, there is somebody that is there for you. The number is on the screen. 988 is easy to memorize. I just saw a story where a 10-year-old took his life because he wanted to fit in. There's no fitting in. If you are you, be you. We love you, appreciate you. And sometimes it seems different because I see more people on social media, being a star or feeling like, I see the confidence there. And then when
Right.
you see people that, aren't as confident, my heart just goes out to, all of this confusion and everything that we're putting on these kids. I don't know the story around Regina King's son. Clearly he was an adult, but there has to be some type of mental health happening where you feel like you have to take your own life. Would you agree with that statement?
I absolutely 100% agree. And there has to be a place and a space where people are feeling, even though we're connected, whether it's through social media, but there still has to be a darkness and a place that you're feeling alone. So
Right.
That's where we want to really kind of tap into. We got to do more of this self-work and self-care. And really, as adults, taking the lead on that, showing that, hey, we're human too. We get upset, we get frustrated, we get stressed. There are things that are overwhelming, but there's some things that we can begin to do about that, whether that's really taking time in our exercise and physical wellness, looking at our nutritional wellness, looking at our mental wellness. So start to make this more of a commonplace so that they see us leading that conversation.
Right.
And that they begin to say, you know what, if they're taking care of themselves and they're performing at their peak still, I need to do work for me so I can take care of myself and be all that I can be as well. So really diving deeper.
And one of the points also is how substance abuse also can weigh in or have an impact on this. So, prayers up for anyone dealing with this. But again, we say if, you need to talk to someone, there's a lifeline that's out there. And 988 is very easy to remember. Now, you've got some amazing services. Kind of tell everyone, what you are doing, because I'm telling you, you're the boss woman when it comes to this. That's for real, for real.
Thank you so much. Yes, so I am an entrepreneur and I'm a licensed clinical mental health counselor. I own 2 companies. One's located in Mooresville, North Carolina, called New Mentality, and the other's located inside of Champion Sports Performance in Cornelius, North Carolina, called Mental Edge Fitness Solutions. Both of my companies focus on looking at our brain, really beginning to understand how our brain is utilizing its energy. And so the work that we do starts with the brain. We do what's called a brain map. We can understand how much anxiety, stress, lack of sleep quality, processing, memory issues, getting a baseline report of how is my brain functioning with that information. Because if we don't know where we are, how do we know how far we can go? A lot of times we might have these symptoms going on, but we have to begin to look at our brain as an organ that can be strengthened and trained like the muscles in your body. So we take a picture of your brain, understand what it's doing in real time, and then we put services in place to help you train that part of your brain to help you feel better. So if you're looking for better focus, more mental energy and clarity, better sleep quality, being able to focus and zone in, who doesn't want that? We have alternative services that are in place that we can help train people to feel better from a brain state first. We also do breath work training, really big into breathing and using your breath to enhance your brain performance. We do visualization, we do counseling. We have some mental wellness supplementations. So really looking at the whole approach in terms of how our mind and body are connected, but how do we get people feeling good from the inside first so that they can perform better in whatever their life requires.
And it's an amazing service that you provide, and more people should tap in on it. Even if you're trying to figure out, I think one of the things that happen is when you say brain mapping, kind of explain that, because it's not like they're having a full lobotomy or anything like that. That is the word for it, right? Because people start getting nervous when you start, oh, wait a minute, talking about my brain. Okay, I can't blame them either. You know what I'm saying?
Absolutely. So yes, let me go a little bit deeper in that piece. Brain map. If you've ever had any type of assessment done, whether it's a physical fitness test, a baseline assessment, just to kind of understand where you are from a weight perspective, body mass index perspective, think about this type of testing very similar to that, which just takes a picture of what your brain is doing, how well it can process information, how well you can power down and relax. So it's just really a non-invasive approach. Nothing's going inside of your brain. You're just monitoring your brain activity. So if you've ever worn one of those heart rate monitors, if you have an Apple Watch on or some type of tracker on your body to kind of track your steps or track your heart, think about this as feedback from your brain. Just really knowing how well you're doing, but also what areas can benefit from conditioning and training. So there's no pain, nothing, can't read your thoughts, but it's more so about understanding how you're using your energy so that you can be better in whatever area you want to be in for your life.
Tracy, why don't we hear more about this method of dressing and talking about why is it that you seem like one of the people? It's like a very it's a very well kept secret.
It is a very well kept secret. And to think about neurofeedback and brain mapping and biofeedback, these things have been around since the 1960s. And technology has evolved over time. But what we found is that a lot of times the first line of recommendation for training and treatment has been in the pharmaceutical world. You know, medication, there's your symptom, here, take this to go treat that.
Right.
And we are not against medications by any means. I think they have a certain place. But this really is a type of therapy that allows you to say, you know what? If and before I go that route, or if I want to complement my medication with something else, this gives you a way to get information and go deeper into understanding how you're doing so that you can be in the driver's seat of your overall mental wellness. Olympic athletes, entrepreneurs, peak performers have been using this technology for decades to gain a mental edge. So on the performance side of things, this has been a big top secret, because nobody really wants to show what do you do to kind of train yourself.
Right.
But my goal and my hope is to bring it more mainstream, make it more accessible so that we all have access to performing better, because we all deserve to.
Absolutely. So how can people get in touch with you? You guys see why I love her now, because this is some amazing stuff from an amazing lady. So how do people get in touch with you?
Yes, if you could just visit my website, tracyalston.com, TracyAlston.com. You'll find information about myself, my companies on that webpage. Go there and please reach out. If you're just looking for a way of where to begin, where do I even start? Come see me. Let's just have a conversation. What are your goals? We can work out a plan together, but really getting you taking care of you in 2022.
Great stuff. Tracy Alston, everyone. She is the bomb entrepreneur and working on mental fitness, working with anybody that needs that to not just to go to the next level, really just to function with everything that we've got going on around us. Yeah. And I love that you mentioned it's an alternative to just prescription off the bat or trying to supplement that, because, you know, we know with medicine, and we're not knocking it because we appreciate the science, but there's always side effects. And so if there's some way you can supplement that, then certainly it's appreciated. So I appreciate you taking the time to talk with me. Again, we've got the Lifeline number put out. But again, I also like the fact 988 is all you have to call. So thank you for taking the time to talk with us. I really appreciate you.
I appreciate you. And thank you for all you're doing.
Absolutely. Absolutely. So as we are starting to wrap things up, you can see with the studio, we had to pre-record that earlier on today, but we're going to get you the information and keep things rolling. Again, I'm Tanya Rivens. This is Canceling COVID. A great conversation with Dr. Trasha Black of Groundwater Solutions, and information and opportunity. They are out and about in the community. If you're looking for testing, groundwater-solutions.org, 704-596-0505. 596-0505. They're on Reagan Drive, also in Monroe, moving to the Monroe Mall, but currently on Highway 74. And your opportunity to get tested as well as get vaccinated, you still have time, folks. Also, thank you to Tracy Alston, tracyaustin.com, tracyaustin.com. A great way if you're looking for alternative, but also just to get your mind right. And who doesn't need that? Mental edge fitness and new mentality. It's time for us to head on out the door. I'll be back again on next Tuesday. A lot of great people lined up and getting ready to come and bring you real talk, real resources, and great information. We want to say thank you again to Groundwater Solutions, groundwater-solutions.org, for being a sponsor of the show. Also, Mecklenburg County Public Health, mecnc.gov, 980-314-9400, 980-314-9400. I've said this before, and I'll say it again. You have to respect and appreciate that our local county health department can take the time for a little old podcast like mine and sow into it and show support, knowing how important it is to get the information out to our community. I'll see you guys on this Saturday on Praise 100.9 FM. Check in with me at 10 o'clock and hang out. As always, life's challenges make you better, not bitter. Have a great week, everyone. Again, real talk, real solutions, working together to cancel COVID. And of course, you see me looking off from side to side, time to time, because I'm also producing the show. No complaints there. I just want to say thank you for your continued support as you hop on and hop off. No comments today, but do me a favor. Please share. Let people know that we are here. Again, please let people know that we are here, an opportunity to get the information. And you can always email me at rivenstanya@gmail.com. rivenstanya@gmail.com. Thanks for hopping on, everyone, and have a great day and enjoy the rest of your week. And as always, thanks for tuning in to Canceling COVID.